Welcome to the Protecting Your Nest podcast. From the moment we are conceived, we are exposed to so many things that can harm us. Things that our parents are consuming, including their medications, alcohol, or even the environment our parents live in, can actually have a tremendous impact on our developing bodies. These exposures continue once we are born and continue throughout our lives, yet we somehow find a way to thrive in spite of the many challenges that we face along the way. What can we do to, reduce these exposures? What can we do? And what I tell my patients is that if we simply focus on removing things that harm us and adding things that help us, we'll do just fine. Today, I wanted to bring a good friend to the podcast whose experience will help us think of a couple of ways to protect ourselves, just in case some of them have fallen off your radar. Today's guest is Dr. Pete Thomas. Dr. Thomas is formerly the Director of Medical Support Services at Near North Health Service Corporation, where he was involved in the administrative and clinical services of all medical assisted therapy, that's opioid addiction services, and early intervention services, which deals with HIV. He has recently joined the executive team of Howard Brown. He is also a practicing attending physician part-time with Near North, and he received his bachelor's degree in chemistry at Xavier University of Louisiana and his medical degree from the Chicago Medical School in Chicago. He completed his residency training in internal medicine at Rush University, Illinois Masonic Medical Center in Chicago as well. And his area of interest is addictive medicine, HIV, public health, preventive medicine. Dr. Thomas is very passionate about the vulnerable populations, particularly Black men like me and him, and in communities of color that are disproportionately impacted by the opioid crisis. He's also someone who was featured on CNN's Blacks in America Part 2, Project Brotherhood, a Black Man's Clinic, the solutions as today's pioneer in healthcare. With that, my brother, I welcome you to this episode of Protecting Your Nest.
It has been a long time coming, Dr. Hampton.
Yeah. Well, for me too, my brother, this is something we should have done a long time ago. And our listeners will, maybe they'll be surprised or not surprised to know that we have a lot in common.
Yeah.
First of all, we attended the same university. We majored in chemistry pre-med at the same university. We both went to Chicago Medical School. In fact, I've been hanging with you for 8 years straight, which is insane. And
This
we
is
also, isn't that crazy? And we also pledged the same fraternity. We were on the same line with Alpha Phi Alpha Fraternity Incorporated. So, I mean, we got a lot in common. And again, that's why I'm so happy to have you here. It's like hanging out with an old buddy. And even though we live in the same city,
yeah,
we weren't really connecting a lot because we're very busy. We have families and,
yeah,
we're busy as clinicians, and it was kind of rough. But I'm just so happy we finally had a chance to connect. And that's why I'm thinking maybe the first thing I'd like to have you share is, one of the things that keeps you busy is family. So maybe you can share a little bit about your family, wife, kids, and so we can get to know you that way.
yeah, absolutely. Dr. Hampton, let me say this before I get into that. I'm just going to say publicly, I don't think I'd be here without you.
Mm,
And I mean this, I'm not trying to be sentimental, but just, your companionship, friendship, and you made going to school easy because, you were from my town, you were from Chicago, I was from Chicago, and we worked hard, we had fun, and it was just a ride. And it wasn't like we were working as hard as we were, but I can honestly say kudos to you. God bless you, brother, for your motivation, and I'm proud of you. And I love this podcast. I love to watch some of the episodes, and so hey, I appreciate it.
that love is returned. And before you even comment, I just want to say I feel the same way. And I will say this, man. Very few people had my stomach hurting. Now, most of my listeners know I had I had irritable bowel back in the day. I'm not talking about irritable bowel. I'm talking about a guy who could make me laugh. I mean, I missed that, and we laughed and
Yeah,
we laughed and we suffered through medical school. We suffered
yeah,
through college, and so thank you for keeping a
yeah,
smile on my face, my brother. I appreciate that.
yeah, yeah, absolutely. Um, so I'm from Chicago, the South Side. I grew up in a very humble background, middle class America. Um, I went to Academy of St. James Catholic School on the South Side. Went to Xavier um, for undergrad. Phenomenal experience. HBCU pledge a phenomenal, the best fraternity ever. Alpha Phi Alpha Beta Tau chapter with this guy. He was a couple of numbers behind me. And honestly, Dr. Hampton, I don't know if you know, but there's about five of us that are physicians on our line.
Right.
I think we
Yeah.
had four docs and one dentist, few attorneys.
Pharmacist,
Yeah, yeah,
accountant,
pharmacy. Yeah, yeah. We had a
ministry,
real
brother
powerful
mentioned
line.
ministry. Yeah. Yeah.
Yeah, yep, yep. Came back here for med school and residency, and then met my wife. Man, met my wife in med school, and she's a family medicine doc, and we have five beautiful daughters. I tried for a son a couple of times; it didn't work out for me. I kept at it though. You gotta admit I didn't quit.
That's right.
But on number five, I said, that's it. I said, that's it.
Yeah.
I walked on out the
That's
ring.
it.
Um, my daughters, I have two that's in college. One's at Xavier. She's a sophomore at Xavier. I have a freshman at LSU. So both of them they kind of, took toward their dad and went down south and for school. I got two in high school and one in eighth grade. And so me and my wife is just battling with the girls. I got a girls basketball team, and so that's what we're doing. And my wife's a family medicine doc, so I've always said I probably should have did family medicine instead of internal medicine.
Yeah. Well, it's funny you say that because as a family doctor who delivered babies, took care of kids, I'm now essentially an internist because I don't see kids anymore. I'm not delivering babies anymore. But
Mhm.
so I can't. We flipped the script there, and I'm gonna tell you something, man. It's funny that you pledged a fraternity, and now you got a house full of sorority sisters. You got like all the girls. So that's all good. So if you ever need a son, I got two boys. So if you need, hang out with some guys every once in a while, we can maybe watch a game together just to give you some of that, my brother. So thanks. It's good
Exactly.
to hear that, and I know you're a family man, so I'm just loving that, and that I'm sure that helps you in your clinical work. So, but let's talk about that brotherhood that we had. Being in the same fraternity, pledging together. I don't know
Mhm.
that words can describe what that bond is like. I didn't know what I was, I think you had more experience with fraternity life before you came to
Mhm.
there. You knew about it. I had no clue what I was signing up for. If I had
Yeah.
known, I'm not sure I would have signed up for it. Although I do, it was an experience, I tell you. So
Yeah.
as you reflect on what fraternity life meant to you, back then, because a lot of people may not understand what a historically black fraternity, what that means, right? So just
Yeah.
talk a little bit about what that brotherhood has meant to you, and what kind of stuff it's adding to your life.
Yeah. So, and I think to your point, there is a distinction between traditional, what we call BGLOs, Black Greek letter organizations, where it's sort of founded out of the necessity because many collegiate African Americans had quite a bit of adversity against them because of the color of their skin and racism that was happening at the turn of the century back in the early 1900s. And so Alpha Phi Alpha was the first black fraternity amongst all the BGLOs, the Black Greek Letter organizations, and largely because we needed support academically. So support academically, but also, hey, where do we go to wash our clothes? Hey, where do we go to get a nice home cooked meal? And so that kind of supporting the future generation that was going to help to liberate African Americans was important. And so people saw the need to say we need an organization, but not just an organization that was just we write a couple of bylaws and then here we are, but also a fraternity that binds us together, that binds us to help each other and help the community. So Alpha Phi Alpha was founded with those principles. Fast forward to two young men coming from Chicago that and and I don't want to speak too much about your upbringing, but I needed that brotherhood.
Mhm.
Now I knew brothers in the hood, and some that brotherhood wasn't always good for us, right? The
Right.
gangs and things like that we
That's
knew
right.
about in high school. And I'm gonna say that wasn't just the only. I mean, I was a part of a little league that was very instrumental and powerful, and we had elder gentlemen that was responsible for us. Well, that fraternity became that for us in college, where the guys that we looked up to were guys that were smart. They were going to med school, going to law school, and so those became our mentors. And to me, that fulfilled the responsibility of our original founders, the Seven Jewels, that wanted Black men to have support systems so that we could then go on and achieve many things academically as well as in society, and then help the community. So it's not just about you know, becoming a lawyer or a doctor, Indian chief, but it's
Mhm.
about using those skills to then help the community.
Yeah, and you did mention earlier how when in our on our line we had pretty much everybody was successful, and I think just being a African American male in college is already a win. But man, the things that you gain from having a brotherhood, that support you get. I mean, you literally just get people just got your back. And I was a little bit of an introvert, and although people can't always tell when I'm
No,
around, I'm very social. But in terms of like my comfort zone, if you notice, I wasn't always at the parties.
right,
If
right,
I wasn't, you
right,
literally had to say, "You coming to the party?" So that
right,
wasn't, like, naturally my thing, but
right.
certainly when I get to the party, I know how to behave around others, but Imma tell you something, that was, I remember in I think it was the junior class. So I'm looking at my fraternity brothers, and you got like the student government president, and you got the dean of the college, and all of these deans. Shout out to Dean Bird, who was a father figure for many of us. So I hope he
Mm-hmm,
hears this episode, and all the brothers who supported me. But I'm gonna tell you something. I would have never ran for junior class president. That would have never
mm-hmm,
happened, but by looking at people who look like me, who are doing things, it gave me the confidence, and to be honest with you, as we're both, leaders now in our health system, I honestly think if it wasn't for Alpha Phi Alpha, I would not be a leader today. I just there's certain things in your life that just show you you can do this, and I think that that's one of the things I gained the most. Of course, the community service that we did while we were there and continue to do when you're involved with the organization is priceless. I just spoke for the Alpha Kappa Alpha sorority recently, and just while I was speaking, they were like, "Okay, let's raise money for heart health. Let's, constantly doing things that maybe you
mm-hmm.
wouldn't have done otherwise." So, man, thank you for giving our audience just a taste of what that means. So let's talk about a little health related stuff. And I want to start by, thinking about you as a family man with
Yeah.
those five beautiful daughters, a beautiful wife. And it's so important that we keep you healthy and keep you around, and so that means that you have to do your screening test, right? You have to do the
Yeah.
things that will ensure that if there's a problem, you'll get ahead of it. And we always follow the recommendations of the U.S. Preventive Services Task Force. And recently, you had an opportunity to exercise one of those recommendations
Mm-hmm.
by getting a colonoscopy literally 2 days before we did this recording, right? So
Yeah.
I want you to talk a little bit about that experience, I'll say this first. The recommendation, we got a memo recently that we can start screening everybody at the age of 45 as opposed to 50. Now, in the communities of color, we were already kind of leaning towards 45, particularly African Americans. But I want you to share a little bit of your experience, because so many people are running away from that test, which is one of the best tests to get to prevent disease. So talk a little bit about your experience.
Yeah. So just to give you some backstory behind that, um, I lost my dad. We were juniors. We were juniors at Xavier. I lost my dad from complications from a aortic aneurysm repair. And then later in after medical school and residency, I lost my brother early to complications for AIDS. And I say that because the responsibility that I had as the last boy in my family, I wanted to honor them by making sure that I'm diligent about taking care of myself and getting my screenings. Because I told my wife, I said, I don't ever remember my dad ever or my mom talking about getting a colonoscopy. And so I wanted to make it public to my kids. Hey, you guys, I'm going for my colonoscopy. I got to drink this gallon of gook that's going to make me poop and all the rest of that kind of good stuff. And so I wanted it to be a big brouhaha so that they can remember me doing that. You know, so I had my youngest daughter draw faces on the at different levels of when I drank the Go Lightly. So, but to get to what we were saying, I mean, for me, and also, being a former director of a men's health program, I wanted
Mhm.
to honor every single man. Dr. Hampton, you know how many colonoscopies I've ordered and referred people to and ordered Go Lightly for people, and I myself had never had it done. Now,
Right.
largely because we wasn't of the age to do it, right?
Hmm.
And so I said, now it's my turn, and now I got to be a big boy and put on my big boy underwear and go do what I need to do. And to your point, the biggest part of it was the cleanse, right? Is
Hmm.
getting
That's right.
that gallon down and then going to that bathroom and coming back and then going back and then going back. And so I made my kids be a part of the process, and I was, making games and stuff like that. And so they were just all laughing at me and stuff. But the main thing was I was able to get the procedure done. It was very uneventful. I don't the There was nowhere near the uncomfortable feeling that people had described before me. It
Mhm.
was nothing. I didn't fall asleep like I thought I was going. I thought I was just going to be like knocked out. But for me, it wasn't that. But I was sitting there watching for a little bit. Then I said, "Well, okay, let me just try to close my eyes and see if I might fall asleep." I didn't fall asleep, but it was not that bad, bro. It really wasn't. And I felt a little pressure on your belly, kind of like
Mhm.
you need to go to the bathroom kind of pressure, but nothing like I need to take a Tylenol or ibuprofen kind of pressure. So it was good, man. And I was in and out of there in 30 minutes. They kind of watched me for another 30 minutes, 45 minutes, let me eat and make sure that I could pass gas and everything. And so, and then it was over with. And today I just got my path reports. They found two polyps. I can tell people that they found two polyps. And so the time period for me is not 10 years now, but it's 5 years. So I have to go back
Okay.
in another 5 years and just make sure everything's okay. We talked about this on one of our shows, our Facebook show, Couch Conversations. That we had an old professor that used to say, if cancer is the answer, tissue is the issue. So
Hmm.
the polyps that they removed, they had to run cytology on just to make sure that it wasn't cancerous. So all cancers come from polyps, but not all polyps are cancerous.
Yeah.
And so I was happy to hear when I looked at my portal that my cytology that those polyps were not cancerous. So I was like, thank God for that. And now I want to work at not just waiting till the next 5 years, but really trying to lose some more weight, really trying to
Yeah.
reduce all of my inflammatories, insults that I do. And I think I do a pretty good job, but I can do better. And
Hmm.
so those are the things I'm gonna be working on.
Yeah, and it's I think about your dad and your brother who you lost not to colon cancer but to other conditions, and man, the value that they add to our lives, right? And to not
Yeah,
have them here, especially your young brother, my goodness. So
yeah,
just thinking about that, it breaks my heart. And I do remember when that occurred.
yeah,
And then I think about other people we've lost. If I could just name one, it would be Chadwick Boseman,
yeah,
our superhero, right?
yep.
Our man, Black
Hey,
Panther. And I mean,
Doc,
just
Doc,
yeah, go ahead. Tell me what you think
can,
about that.
can I tell you? I remember you guys were so supportive. I remember going to my dad's funeral. I came back home. We had a comparative anatomy test, and you guys had gotten the cat that we were supposed to dissect. Y'all had brought the cat home for me, and y'all helped me, catch up for that test. You and my roommate, who's also our line brother. I mean,
Yeah.
man, this makes me a little emotional thinking about this. How you guys, this is what we talk about, the fraternity piece, where you
Yeah.
guys put your arms around me, and not just, I mean, yes, like from an emotional perspective, but it was real being able to get off the plane and you guys had my back. Like, look, we
Man.
got to, we know you got an anatomy test coming up. Let's get to it. And
Let's do
so,
it.
man, I really appreciate that, brother.
You know what? If you think about it, I just mentioned Chadwick, man, but those are the real superheroes, right? I mean,
yeah,
they swooped down with their capes on and said, "We got this." And I remember anatomy. I don't care at any level I had to take that stuff. It kicked. That stuff is a lot to remember, man. It's
it's
like,
a lot.
what, you want me to remember what?
Right,
Nerves and arteries, and
right,
it
right.
was crazy. And and
I
and
had to
that's
get
why
over
we
the
need
fact
to
there was a cat in my living room first. Let me just get over that. Let me just sit and I need my brain to absorb that.
That's
There's
right.
a
Yeah,
cat in my living room, and I'm sitting here looking at nerves and
I
arteries,
know.
and I'm just like, oh Lord.
I know it, and if you recall, I remember. I don't know if you had this experience, but when I was in medical school in anatomy class,
Right.
it was you freak out at first, especially when you get to certain parts of the body. Like for me, it was the hands. It was something about the hands that freaked me out. But about a month later, man, you walking in there with a sandwich in your hand. It's like
That's,
it's like, what are we doing? I got a sandwich in one hand.
right.
I'm like, okay, I'm about to dissect. It's so. I think you adapt, but I agree. That experience of having people to support you. And I do want to say this when it comes to African Americans, only about 63% are getting screened. And the
Mm,
problem with that is that we have a 20% higher rate of colon cancer as a general rule. And if we get colon cancer, we're 40% more likely to die. So we really don't want to miss an opportunity to get screened for something that literally, I mean, is it really a screening test? It's more of a prevention test because those polyps that were removed actually remove things that could turn into cancer. So it's really, you're not screening, you're almost treating. I mean, you're really going
yeah,
in there and actively fixing
yeah,
what could potentially kill you. So I really consider it more than a screening test. So I'm just happy you had yours. I had mine right before the pandemic, and as you have suggested, I was a year later than I should have been. I'm just happy I got it done. I was fortunate. It was not a difficult experience at all. So let's talk a little bit more about other areas that you're expert at. In your intro, I mentioned, opioid addiction services. I mentioned HIV, and as you know, that protecting your nest. That if you're going to protect your personal nest, you have to follow certain principles. One thing I learned in functional medicine is something called the 5 R's, and what that means is you remove, you restore, repair, re-inoculate, and relax. And that's really about how we protect our digestive system. But your training with
hmm
opioids reminds me that in order to heal from drug addiction, it also requires removing those drugs, which are, harming us, and hopefully being able to then restore and repair afterwards. So, talk a little bit about, how you help patients who suffer from opioid addiction, which is a huge issue in many communities in America.
yeah. So, just to give your audience some backdrop, right now, as we think about, we're in a COVID pandemic right now. Simultaneously, there is an opioid overdose epidemic that's happening.
Mhm.
70,000 people died 2019 from opioid overdose. These are people that I want to call, they're invisible. because many people have been disconnected with their families, and when they're taking the heroin, that they may take more than what they required for their usual high, and then they end up dying, and no one knows. So we're in this opioid epidemic that's happening, and it's affecting our families, and many people that have family members, they know it's a big deal. And so, to
Mm-hmm.
your point, we know that OUD, which is called opioid use disorder, is a chronic relapsing condition that's impacted by your genetics, by the environment, and then, of course, by your external stimuli. Right. So you're right. We got to get people away from it, but then that's not enough because people are addicted to the drug and what the drug does for them. The primary sort of circuit that's affected is dopamine and the mu receptor in your brain. So it's that reward system, it's that brain circuit reward system. Kind of the same thing with sex and food. It wants constant dopamine attached to this mu receptor, right? And so the heroin does that, and it has a very strong affinity for that receptor. So what we have something called medication assisted therapy. Now we're calling it medication assisted recovery because recovery is more descriptive in the fact that it's not a static process. It's a dynamic process, and that it's not always it's a one and done. Once you go get your methadone or your Suboxone, then you're off and running, and your life is beautiful again. Doesn't work like that, and I'm sure you know this as a diabetes specialist. We got people that fall on they get on the bike and then they fall off. And so as providers, it's important for us to set the bar low, or at least have them have a realistic expectation for what it means to be in recovery. So MAT or MAR, medication assisted therapy, is three things. It's not just the medication, but it is pharmacotherapy. That's important to break that cycle of dopamine and mu receptor, because buprenorphine, which is Suboxone or methadone, has a stronger affinity for that mu receptor than does heroin does. So it will kick it off of that receptor. So pharmacotherapy is part of it. The other big part of it, and I know you had Dr. Cersei on recently, is behavioral health. Many of these
Mm-hmm.
patients who are addicted to opioid use, who have OUD, have comorbid behavioral health conditions: depression, anxiety, PTSD, post traumatic stress disorder, schizophrenia, bipolar.
Mm-hmm.
So that's an important part of MAT or MAR. And then the last part is addiction counseling. So you need someone that is a certified addiction counselor to go over it. So at our MAT or MAR clinic, we make sure that we have all parts of those components happening simultaneously. I will tell you it's difficult because many people just want the one part, which is the medicine. But if you
Right.
neglect those other parts, it's easier for you to fall off that bike. And so the idea is get all your equipment on, get your helmet on, get your shoulder
That's
pads,
right.
get your knee pads, so that when you fall off, it's not a matter if you're gonna fall off. And the
That's
question
right.
is, how do we protect you while you fall? And so
Mm.
that's what all those components do.
And I love it. And we always talk about, even as I'm dealing with obesity and diabetes, that, 80% of it is behavior. We have to change the
For sure.
behavior, and we got to deal with the mind. So I could see even more so as you're dealing with opioid addiction, that's even a bigger issue, because there's just some things that have led to that need to be addressed. And a lot of times those things don't ever go away. Addictive neurons don't ever go away. So you're going to really be battling them for a lifetime. And you just want to have the support, just like a fraternity or a
Yep.
sorority that's around you to support you as you take your journey. So thank you. I just wanted to, and what's really cool about this conversation is, don't think it's not happening to your family. Don't think it's not happening to
Mm,
somebody you know. Don't get it
mm,
twisted. Don't think because you're in a
mm-hmm,
nice suburb that this won't impact you. There are plenty of people who you may know, and it may be you, who are in trouble, need help, and we have people out there that's there to help you. So I just want to say that, because I think that a lot of times we think it's somebody else, and I've lived long enough to know, no, I don't work that way. Things
mm.
happen to all of us, and we just want to have resources in front of us to help us. So So let's go to another area of expertise that's in your wheelhouse, and that's HIV. And I tell you, so many people are at risk for HIV. I think we used to be like so afraid of it, kind of like COVID. COVID was so scary, we didn't want to like breathe the air, and now people are in restaurants just chilling like it's no big deal. So a lot of times, over time we get desensitized, but there are other things out there that maybe in certain communities. I talked to a patient just today, and he
Mm-hmm.
was in the gay community, and he was like, "Well, in the gay community, we know about the PrEP prophylaxis,
Mm-hmm.
treatment, but the question is, does everybody know about the PrEP?" Pre-exposure prophylaxis for HIV. So
Mm-hmm.
I wanted to bring this conversation to my audience because, first of all, because you're here and this is an area that you're comfortable with, but
Mm-hmm.
also, so part of it is what the heck is that, and
Mm-hmm.
who should be considering PrEP, pre-exposure prophylaxis?
Yeah. So again, as the divine universe would have it, God is so awesome. When I did my residency, I did the infectious disease portion of it, and it was a particularly hard rotation where I did it, and those I did really well in it, and those guys took a liking to me. So they said, "Hey, we know that you have to pick up a second continuity clinic. We want you to have our HIV clinic be your second continuity clinic." And I'm thinking to myself, I had just found out that my brother was HIV positive, and I
Wow.
did not want the reminder of that as I worked. But as God would have it, when I tell you, Dr. Ham, that these guys would not take no for an answer. They would just come in like this practice. So finally, my program director told me, guess what? Your second clinic is going to be the HIV clinic. I was like, okay, I guess that was the answer for me. So, and then I ended up continuing that clinic at Cook County and worked there for 17 years at the Core Center. So, what I can tell you about HIV is this: 1.2 million people diagnosed with HIV as of a year ago. Of
Mm,
those, only 86% of those folks are aware of their diagnosis. So that means 14% is walking around unaware that they're positive for HIV.
wow.
Of those, of the 86%, only 54% are actually engaged in care. That means they actually
Mm,
identify a place as their primary care home. Then, of those, only 52% are on antiretroviral therapy, which is the medication that we use to keep people healthy and strong and keep their viral load
mm.
zero. And then of those, only about 50% are actually virally suppressed, which means they're so now the only way we're going to end this epidemic is by keeping people virally suppressed. So we don't have a cure
Right.
right now. The closest thing we got to a cure is getting people's viral load, meaning the amount of virus in their system, down to zero. The only way we can do that, if I work my way backwards, is that people are on the medication. The only way they can be on medication, they have to be engaged in care. The only way they can be engaged in care is that they know that they're positive.
Right.
And so PrEP is the medication that we're as one of the sort of number one priority in ending the epidemic because it is the medication that has been shown 99% effective in preventing HIV. And
Slow
we would
down, slow down,
basically,
slow down.
yeah,
99%. Slow down. There's very few things in
come on now.
healthcare
Yeah,
that are that effective at preventing anything. 99%. So keep going. I just wanted to say that.
yeah, yeah, 99%. And so
Mm,
so it is imperative that we identify high risk populations and get as many as we can onto PrEP. And say who's high risk. So many ethnic communities are high risk. I'll give you an example. African Americans and Latinos make up combined about 31% of the population, but they
mhm.
make up 69%, almost 70% of people who are HIV positive. Okay.
Wow.
Men who have sex with men who have sexual contact with men are at a high risk. People who use IV drugs are at a very high risk. Sex workers are at a very high risk. So it's imperative that those part of our population is definitely on PrEP. Who else needs to be on PrEP? Anybody that wants to.
Mm-hmm.
We say if you're having sex, you never know if your sexual partner has ever had sex as a way to take care of themselves. That's called a sex worker. So
Mm.
if I'm having sex in order to negotiate my where I live and how I eat, that's a sex worker. So
Right.
when you say, "Well, I would never be around anybody, let alone have sex with them," you don't know what people are doing. The person that you met
That's
at the
right.
club and at the bar and whatever. Okay, men who have sex with men, we don't know. And so what we say is that if you are having sex, you are at risk. If you are at risk, you should be on PrEP. Because being on
Wow.
PrEP doesn't hurt you. It doesn't. It doesn't. It has a very low side effect profile. It's basically two medications. The first medication that was discovered was back in 2014. Is Truvada, which is
Mm-hmm.
basically intracytidine and tenofovir. And
Mm-hmm.
now the medication, the sort of new and improved Batman version, is Discovery, and that
Mm-hmm.
medication is even better tolerated. Doesn't work better. It's still
Mm-hmm.
very effective, just like Truvada was, but it's just better tolerated and less side effects. And now, Dr. Hampton, just to call in the Avengers on you, we have a medicine called cabotegravir that's
Mm-hmm.
injectable and it's once a month.
Mm.
So,
That's what.
man,
Yep.
talk about the Avengers coming. So, the only drawback to the once a month is it may give people this comfort level of not doing the other things to help protect them from HIV and
Right.
other
Right.
STDs. And so so we're still like kind of wrapping our heads around what does it mean for a PrEP
Mm-hmm.
person to have an injectable medicine that they're given once a month, as opposed to taking a pill once a day. You're ever so reminded why I'm doing this. So it does
Yeah.
still mean minimizing your sexual partners, wearing a latex condom, making sure that your partners are you have a clear communication with them about other activities that they might be having. So yeah, prep is big and it's important, particularly in those communities that I talked about that are at the highest risk.
You didn't mention, I know we started our relationship in college, but it just seems like college students in general, because
Yeah.
you're finally, particularly if you've gone away from home, you're not at home, you don't have the barriers to getting with somebody because you're freer,
Mhm.
and it seems like that would be a group that would want to consider this. So that's pretty eye-opening. Again, that's why I wanted to bring it, because I don't think this is just something that only a gay person or lesbian person should be worried about. This is something that we all need to be aware of, and then you need to reassess where you fit. Also, am excited because I recently heard that some of the technology that we're using for our vaccines, messenger RNA in particular, they're starting to move some of that same technology towards HIV. So it is a gift to know that what was negative, the pandemic, may ultimately get us on a path to have a vaccine for HIV. So I'm looking forward to that big time. So I want to throw some more data at you and talk a little bit more about this topic, and we'll move on.
Mm.
When I Advocate merged with Aurora, so Advocate Aurora now is in Illinois and Wisconsin. So since
Mhm.
we merged, I had to learn a little bit more about Aurora, which was in Wisconsin. And so I thought about our conversation, and I learned that in 2019, African Americans were only 16% of the population in Wisconsin, yet they comprise, similar to what you mentioned, 68% of the cases. Think
Mhm.
about that. That's a remarkable statistic. And another thing that was interesting in terms of African American gay men, the chances that they would have HIV in their lifetime was 33%. Think about that. So if you're a gay male in Wisconsin, you have a 31 in 3 chance of getting HIV positive in your lifetime. And then when you go to the Hispanic population, it was 10%. When you get to the Caucasian brothers and sisters, it was only 4%. So that's a disparity that's striking, you know. And
Hmm.
so my question to you is, since I know you do a lot of work in the community, you know, talk a little bit about why you think that's such a high disparity.
Yeah.
You know, what's going on that would explain why African American men are, you know, at 33% and Caucasian gay men are only at 4% lifetime risk for HIV.
Yeah. So, so anybody that does this work would listen to your comment and say, "Hmm, so you mean to tell me that 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 fish is usually wet and that uh, bacon tastes real good?" And so because it doesn't sound out of proportion with what we do every day. So
Yeah.
what we know is that, lifetime risk for Caucasian men, 1 in 16, Hispanic men who have sex with men, 1 in 6, black men who have
Mhm.
sex with men, 1 in 2. So you take
Mm,
10 black men in a room who have sex with men, 5 of them might be HIV positive, are
mm,
likely to be HIV positive. So, what is the cause? If you think about the burden of disease in the United States, we think about that in terms of that Bible Belt. So,
mhm,
your Texas, your Georgia, your Alabama, those are where the rates of HIV are very high. There's only a few exceptions to that. There's only a few states that sort of numbers rival those southern states. Illinois is one. Wisconsin is one, and
mm,
Pennsylvania is another one.
mm.
And so then you start to look at what rural Illinois looks like, because people always think Chicago, but Chicago is a tiny blip in Illinois.
Mhm.
Most of Illinois is very farm country. So most of it, but you take Chicago outside of Illinois and it looks like Georgia. It
Right.
looks like, Alabama. And so I say all that to say that states that impact your social condition, and we talked about this. I even asked you, I said, Dr. Hampton, I want to bring on my slide on what a
Right.
principle in public health called the social determinants of health.
Yeah.
And I looked up this also about Wisconsin, and the CDC doesn't, and the surveillance reports is not definitive as to why we think that that Wisconsin is such an outlier, right?
Mhm,
But what we think is that Milwaukee has a lot to do with it,
mhm,
and not only that, but that because of the disruption in services, like some of the programs, the condom programs, the needle exchange programs.
mhm,
So all of a sudden we're back to this principle called social determinants of health. What is that? That is the conditions that people live, where they grow up, where they work, and how those conditions impact their health outcomes.
mhm,
What interplay happens with where they live, where they grow up, is a matter of power, money, resources.
mhm,
And so when those communities are the first to get resources taken out of it, the last to get resources put into it, and we're wondering how and why the rates of HIV is up, I tell you something else is up. Heart disease is up in those communities.
mhm.
But
Right.
diabetes is up in those communities. You check it. So HIV is just one blip, and it's a big one. I understand it, but the point is that many chronic diseases are impacted by the social determinants of health, those conditions that people live in, and people we don't think about it a lot. But if you think about it, if people don't have a safe place to live and to work, and all of a sudden sex is a secondary thought to them.
Mhm,
Oh, I'm a African American MSM, a men who have sex with men. I'm at a high rate for HIV. Listen, man, I'm having a tough time eating. I'm having a
right.
tough time finding a place to live. And so to mention to me about, protecting yourself and getting on prep and all of that, it doesn't resonate. And so because of my work with the Core Center and at County and then with Men's Health, we found that you gotta pay attention to the SDOH issues and make sure that you have a wraparound services for people so that people know that they have a safe place to live, they have food to eat, they have some sort of security. And so if you think about a lot of our HIV programs, Dr. Hampton, it's like a team of us that are taking care of people.
Hmm.
Like
Right.
it's never one person passing out drugs. That's that's the minor. That's the 20%. If you know about the 80-20 rule.
That's
The
right.
80 is in the social support. The 20 is
Hmm.
the medication that helps to keep the virus down and all the rest of that. The big gorilla in the room is making sure that people feel safe, they have food to eat, they have shelter, and all those things. Once that's done, then we can talk about, hey, let's make sure you get on prep. Hey, let's make sure you're protecting yourself. Hey, let's make sure that if you're going to use drugs, make sure you're using clean needles. Let's make sure you get on MAT, medication assisted therapy. Those things can be done once that SDOH part is taken care of.
I love it, man. I hear so much passion in your
That's what I
voice,
do, Doc.
and you know what's cool about it? I'm imagining sitting, and I try to do the same thing. I'm sitting in the clinic as a patient, and I walk in a room, and I may see something I don't expect, which is a African American doctor who grew up on the South Side and used to push tires through the alley and jump on mattresses for fun, right?
Right.
And I think that that's important. So, because in your voice is, an opportunity to like build rapport. In fact, you could argue the rapport was built before the patient even showed up because
Mm,
they can relate, and you have tangible experience with maybe a family member, maybe the guy down the street. I mean, I remember the first time Karan, my wife, came to Chicago, and it was, I think we were downtown, and somebody was kind of walking up to us asking for money, and for me, it was like breathing air. I'm just used to that, right? And it don't. There's no threat. I just, you
right,
just do your thing, right? And for her, it's
right.
like she was like, "Whoa!" And then I told her, "This is how you deal with that." So
Yeah,
just being familiar with, that person, and then
yeah,
recognizing that, guess what? Although I may not know that person, the one that's around the house, I've been knowing him for years. And
yeah.
so I don't look at him as a threat because I know who he is, and I know he's really not going to harm anybody. It's just his current state. And I just think having people who are not pointing fingers all the time and
Mm,
blaming all the time and stigmatizing people all the time. That's what we need. We need a world that can view the world through the lens of these people and understand that there are reasons why people have struggled. So I just appreciate you being in the community
yeah.
and your experience bringing that as a leader. So and I want you to talk a little bit about that because you're in the community. You have leadership roles. You're still seeing patients. I really value that because it keeps you in touch with the front line of what's really going on. What types of interventions or things have you seen, done, participated in that has really kind of moved the needle, you think, and improved care in our community?
Yeah, that's a good one. I think, well, one, if I would just culminate all of the experience that I have, and that is having not just one sort of medicinal model. The medicinal model works to keep certain populations healthy. To keep the larger population healthy, you're going to need to move outside of the traditional model and look at other things like the SDOH, the social determinants of health. And that means combining services. So that means not working in silos, but having the the social worker at every clinic visit, having behavioral health at every clinic visit. That means some days this person doesn't need to see Dr. Hampton; they need to see Dr. Cersei. They need to get over the trauma that happened to them because Dr. Hampton can't bring those blood sugars down if they're still dealing with nightmares from what happened to them as a kid. So not looking at traditional models, thinking about health in a more broader perspective. The two is having a cultural specific care. So I
Mhm.
think it's important to have people of various ethnicities take care of people. Look, we make up 13% of the population, African Americans do, but yet there's only 4% are doctors. So we need to have more black. Now, do we need to have more cultural competency classes and courses and trainings? Sure. but there's nothing that takes the place of them opening up that door and seeing your face,
That's
because
right.
there's a comfort level that goes over them that says, and I have to tell patients, I have to tell people, sometimes people say, well, this person wants to see a black cardiologist. And I don't know. I think that sounds racist. I'm like, no, it's not racist, because
Mm-mm.
what they're saying is, I want to be able to communicate freely and not have to, sort of second guess my communication to the cardiologist. Now you can say, well, they should be able to communicate freely with anybody. That's a big should. And what
Mm-hmm.
happens as a result of, if that should doesn't happen? Then Mr.
Right.
Jones just sort of dies from a cardiovascular event that maybe could have been prevented had he have had what he asked for, which was a African American cardiologist. So I digress. So I think culturally specific care, improved access that's broad, and the last one I think is addressing health inequities. We got to
Mm-hmm.
start looking at the fairness of things and start to operate outside of the box. Let me give you an example. So if I know that the colon cancer rates are higher in certain population, why then would I wait until the normal
Right. Right.
screening recommendations? There, we should be given the leeway to say, I'm going to screen this person early, and I don't want
Mm-hmm.
them thinking twice about who's going to pay for the colonoscopy.
That's right.
I don't want them
That's
thinking
right.
about that. And I'm saying this because I feel passionately about it, because that's what happened to me. And here I am, I'm a doctor, and I went to my doctor and he told me I was too young. And I'm like, but I'm a black man and I got higher
Right.
rates. And he said, well, and then because I'm a doctor, he said, well, a lot of doctors, have them to order it. That's just inappropriate.
Oh my
It's
goodness.
inappropriate, and it's not
Yeah.
right. But anyway, I say those three things are the big things that I've learned that could help intervene, and I think move us to a better health outcomes for communities.
Thank you. And those nuggets are well received. And I hope that if anybody listening is a clinician or is in a position, operations person,
Mm-hmm.
please, if you're at the table, at a meeting and we're talking about these topics, please raise your hand, speak to these topics, and remind people that if we don't provide a way for people to do better, then they're not going to do better. And we have to give them the resources. And we one day we'll live in a country where we have universal health care, and this will be a standard. Until then, we have to keep fighting. And these things that we want to see happen won't change on their own. Every time you go to the things from the past, Medicaid, Social Security, all that kind of Medicare, all that stuff required a fight. It wasn't that president. It was the
Mm-hmm.
it was the people who demanded change, and they pushed these leaders to do things that would improve our community. So I'm loving that. I was so proud, man, when I don't even know if I knew in advance. I just saw your name popped up, featured on CNN. And it was a good feature. It was something
Yeah,
good going on,
yeah.
and it was that Blacks in America Part Two. I mentioned it in the intro. Project Brotherhood, a Black man's clinic. So absolutely want you to talk about what that project was all about and why it was important for you to be involved in that project.
Yeah, that was God's plan, because again, having lost my brother and my dad before I should have, and just to be a part of that. Dr. Terry Mason had a event at his house. He's a mentor and close friend of ours, who's on the couch conversation with the doctor. Terry had an event in his house, and I met this guy. Dr. Eric Whitaker was starting this Black men's health clinic at Cook County. And so, as fate would have it, I ended up having, that was my first attending job, fresh out of residency. So for your audience, residency, there's no money, they work you to death, and then all of a sudden you become the attending physician and you get a little bit of money.
Right.
But my first job was going to Cook County to be an attending, and I had the pleasure, because I was at that event. I talked. My boss was Dr. Linda Murray. I talked to her and I said, "Listen, I want to be a part of that men's health clinic. I want to be a
Mhm.
part of that." And so quickly, as things would have it, I became the medical director there. But the whole principle there was, again, looking at health in a different kind of way, and that in a way that did not just mean writing prescriptions for people.
Hmm.
That helps a percent of the population. And those are the percent that really, no matter what you do to them, they gonna live to be 80 years old, and
Right.
they're gonna be okay. All life is gonna be great. But then there's a percent of population that won't, and they live on the fringe. They live right on the edge, and it's a lot of trauma. It's a lot of insecurities. It's a lot of food insecurities and safety insecurities, and it's communities that we're very familiar with. And so to practice there and to focus just on men, and one of the big things was when the medical students would come to rotate with me, I told them, I said, now for the men's clinic, we got to take off the stethoscope, we got to take
Hmm.
off the tie, because
Mm.
those are things that make us feel good as the healthcare. I'm the expert. I know
Right.
more than you. I was like, but that don't necessarily make men who want to take care of themselves feel comfortable talking to you. So we're going to take all this stuff off. We're going to take
Hmm.
off our ties, and we're going to be
That's right.
real people to them. And then you'll see sort of the dynamic. The students loved it. We loved it. It was, five Black men taking care of patients, and we had a social support group. We had a manhood development group. We had a
Cool.
barber cutting hair inside the clinic, and we got our grants from traditional sources. But when we would get the grant, we told them we're not just going to be talking about cancer prevention or HIV prevention, because all those things are sort of wrapped into other conditions that predispose them to cancer and heart disease and stuff. And so they loved it. And we got funding, lots of funding for it. And of course, our major funding came from Cook County,
Hmm.
which had my salary and all the other doctors' salaries. And I think the advantage of that was that one is the county benefited because they get to have a diverse workforce.
Right.
So contrary to people's belief, there's not a whole lot of African American doctors at county, and so it was great that because we had this men's clinic, it became a sort of a reason to recruit people that looked more like the community. Now, you would
Hmm.
think that would be just sort of a rocket science kind of move, but you'd be surprised. And so it was great that we were getting the national publicity, and then we were getting the funding, and it was able to to fuel getting a more diverse, in other words, hire more Black male doctors that could take care of these patients. Man, it was great. I had a ball. I had a ball while
Wow.
I was there.
That's beautiful. And man, if I can go to the clinic and get a nice shave or a haircut, that's
Yeah.
a win-win. And just as a reminder, I've mentioned this on a podcast before. You may be looking at 500 or 600 African American men who go to medical school every year. And when you think of a country of the size of this country, 360 something million people, that's just not going to be enough to take care of the needs of. I mean, that's basically, okay, let's just say 10 docs per state,
Yeah.
really. And that's what we're
Really.
in 2022, that's where we are.
That's
So
where
we
we are.
really, shame on you, USA. Let's do better.
Yeah.
And we're going to keep putting this out there so people will learn and be ashamed of those statistics. So, but one thing you also mentioned was my brother, Dr. Terry Mason. And
Hmm.
I had him on a podcast, which was unusual because most low carb docs have low carb guests, right? And
Right.
but my podcast is a little different, where I want to hear everybody's voice, but it's very
I love that.
interesting for you, and you're kind of one of the main hosts, right? And so
Mhm.
you have me on one end, and by the way, shout out to Congressman Danny Davis, and absolutely love him. I love the work he's doing, and his
Yeah.
wonderful, host, one of the co-hosts, Nikki Harvey, you and her, that you guys invited me to the platform. I've been so grateful just to be part of it, and it's
Yeah.
been awesome. But you have a low carb doc like myself, and you have a low fat doc like Dr. Terry Mason. I've been in the Beyond Impossible documentary where we're saying, plant-based burgers may not be perfect, and then you have Dr. Terry Mason, who's been on Forks Over Knives, and it's basically saying the opposite message. So
Yeah.
as a host, how do you navigate and reconcile those two perspectives? I'm saying it's okay to eat the ribs. He's saying eat the plant. So what's your thoughts
Right.
on that? I thought that would be
You
a fun
know,
question.
let me tell you, it keeps me on my toes because both of you, I'm serious, both of you, I know personally, and you both mean the world to me. And so I think the win goes to our audience,
Hmm.
because I think you've even said this before in the past, because there's no excuse that you have a way to a better health outcome. You can't say you didn't know, because you got two people that are experts
Hmm.
in that particular field. And by the way, which isn't so divergent as you might think, because think about it, it's really an anti-inflammatory approach.
That's
Both
right.
approaches is reducing your risk for inflammation, which
That's
is
right.
exactly what we need to prevent or to to improve health outcomes. Again, one, the GPS tells you to go this route, and the other one, if you end up on, if the thing says whack a drive, you in trouble. I tell anybody, log out if you on MapQuest and they mention the word Whacker Drive, you are in trouble. You will
Right.
not get to your destination, sir. Please pull over. Okay. But no, I totally love it because
Hmm.
I think if probably the first couple of shows, I was sweating bullets between you and Dr. Mason. I was sweating bullets. But the good thing is that I'm serious, because I think both you are very respectful, because one, Dr. Mason came before us and sort of,
Right. He's a legend. He's
he's
a
a
legend.
legend.
Yeah.
Just trailblazed the whole situation, and I think he recognizes that we're the heir apparent, and so
That's right.
he wants to foster that, right? And even if he philosophically disagrees, he
That's right.
still knows that, look, he's the next guy, right?
That's right.
So
Right.
I got to promote the next guy.
Right.
I can't down the next guy. And so, but again, I think it's just anti-inflammation,
That's
and
right.
that's what I focus on. But I have to admit, it was a little stressful the first couple of
That's
episodes.
right.
Yeah.
Yeah. You and Nikki probably both were on the verge of
Oh,
a
trust
major
me.
cardiac arrest.
Yeah. After the show, me and Nikki be like, okay, now, do you need a shot or do I need a shot, or do we both need a shot? Okay, we both need a shot. Okay, so let's go get a shot,
That's
and then
right.
we'll talk about
Yeah.
today's show. Yeah. So, but I honestly, man, you guys have never been disrespectful. Y'all have always
That's
been
right.
very, and that's what's so cool, that we're all like trying to promote a healthy behavior from our
That's right.
audience.
And
And so
that's
it's
and that
never
and
like, yeah,
well, let me say this, like, and as you know, I call myself the metabolic health doc, and that was intentional, because you can achieve metabolic health as a vegetarian or vegan. You can achieve
yes,
metabolic health as a, low carb keto or even carnivore. So the question is, what you're gonna do? Do what works for you.
yes,
And but yeah, it's been fun, and I thank you guys for having me on the show. Another thing I want to thank you for, and people can't. If they saw us in medical school, we were a little on the buff side. You
yeah,
remember
yeah,
that?
yeah,
We used
yeah,
to
yeah,
work
yeah,
out. I was
yeah,
probably
yeah.
20 pounds heavier. Sometimes I would look back on those images. Sometimes Karan, my wife, would look back on those images and say, "You need to go back to that." So, although I do work out and take care of myself, I wasn't that guy.
Yeah.
Sometimes it's hard to maintain that. So, talk a little bit about exercise, and how do you find time for that, and what are you doing to stay healthy when it comes to exercise?
Yeah. So Doc, let me just tell you, for me, that is the first part of my day. I'm probably
Mm,
up when most people are still asleep. And so like I get up routinely, my internal clock is like 4:30 ish. And
mhm,
I'm starting to kind of like get the fog out, and I can start to hear things. And then so by 5, I'm up and I'm getting my clothes ready, and I'm at the gym by 5:30. And
okay,
the good thing is, we go back to the fraternity where we started. I got a group of guys that meet me at the gym, and when I'm not there, everybody's going to be talking some little stuff about me, and so it is like a little fraternity amongst guys,
yeah,
and we're all professional men, and we're there at Dark 30.
mhm,
And for me, what it did as a leader in healthcare is that we get brought problems. That's what people do. They bring us their
that's right,
problems. And so we have to have an even keel. And then we can even talk about, we can bring it to this level. And I'm glad that this is your show, that as Black men and leaders, we
Mm-hmm.
really don't have the leeway to fly off the handle, things like this. Like I've seen other leaders
Right.
say things and do things in meetings, and I'm like, well, if I did that same thing, it'd be a whole nother scenario going on. And so,
Mm-hmm.
but not that's not even my approach to problem solving. I don't
Mm-hmm.
We don't gain anything by going off on people that are a part of my team and helping to take care of people. We lose as a result of that. Cuz I want you to feel free to bring me a problem. Because
Right.
together, I'm not going to have all the answers, but together we can help come up with something. But I go back to working out, and that is, for me, working out helps to calm me. It gets all my
Mm-hmm.
catecholamines down, that those flight or fight hormones that can roll around in African American male physicians, and we die prematurely. That's another statistic that we hate to mention, on top of not having enough of us, but most of us die before we should. So for me, I'm in that gym. I'm helping to improve my immune system, helping to
Mm-hmm.
reduce my stress. I'm getting a clear mind. There are things that might be going on at work and at home, that all of a sudden on the treadmill, I'm like, oh, so this is the approach. Oh,
Mm-hmm.
so, and emails that I may have gotten that I need to respond to that may have gotten a different response, after that, after my catecholamines, I've left all the stress on the treadmill, on the weight
Yep.
bench. I've left
Yep.
all of it there. And the good thing is, I got a group of guys just like you, Tony, that I can laugh and talk with,
That's right.
and even get their perspective on things. And one guy's in IT or software, and so it's interesting just being able to get their perspective on things, and it's a different kind of response. And so then I've like most of my, I've spent a third of my day before most people even get up in the morning.
I love
Um,
it. And
now,
I do
now
my
the
most.
advantage of
Yeah.
that is that I've done that. The disadvantage is by 9 o'clock, my boy, I feel like it's like 12 midnight.
Mm.
By 9 p.m., I'm literally
Yeah.
like, I'm like,
But that's okay. Yeah, that's okay. I'm the same way, and it is. I literally, my wife commented it was probably 8:30, and she was like, "You look so tired." Well, when you get your and I was, because you get your circadian rhythm, right?
yeah,
You want to be tired. The last thing you want to do is hit the bed at 9:30 or whatever, and you're not tired. So you want to be tired, and you
yes,
want to be in a little bit of a rhythm, have that melatonin at the right level. Maybe in the morning, have your cortisol a little bit up in the morning to get you going. So listen, man, that's a gift if you can be in a rhythm, as opposed
yeah.
to going to bed at midnight one day, going to bed at 9 p.m. the other day. That's a
I
disaster.
don't have that problem.
So it sounds so because I was going to ask you, what else do you recommend to your patients? It sounds like exercise, obviously sleep's important to you, reducing stress is important to you. Any other principles you share with your patients in terms of how to stay healthy, just lifestyle related?
Oh, I'm big on laughter, man. I'm big on, getting around people that you can laugh. And I think so many times in our community, there's so many tragic things. And I'm even telling people about those apps where it goes off when somebody got robbed, and it goes off if somebody's
Oh
car
man,
got jacked. I'm
right?
telling, hey, disconnect from that. That's
Yeah,
not
get rid of
good for
that.
you. That thing is
No, it's
just,
not.
yeah, it's trauma. It's like I call it trauma porn.
Yeah,
It's like
yeah,
porn that's traumatic, and you can't stop watching it. It's
right.
like,
That's
who just got carjacked? Who just got this? Hey, shut that off. I mean, and you need some peace. And so laughter is a big one, Dr. Hampton. Sleep, get around people that love you. I mean,
hmm
just get around them. Even when you're in their presence, there's a
that's
certain
right.
amount of to me, life-saving hormones that get secreted when you're around people that love you. And then of course, I'm honestly, sex is a big one, especially for
Yes,
men, because men self-esteem is based on their ability to have sex. And some women say, well, that's just superficial, and that's just, it is what it is.
right,
So
right.
I recommend that my male patients and my female patients, I really do recommend that they have sex, and I
Mm-hmm.
tell them to do that responsibly. Now I tell them, men, don't be going around talking about now. You know, Dr. Thomas said I need to go have sex, so you got to go lay down and all the rest of that. I said, wait a minute now, you got to have a consensual
Right.
situation happening. I don't mean don't be demanding nothing from nobody. I don't care if it is your wife. Still, uh,
Right. Yeah.
but I those are the things that I recommend, and and I even look forward to even myself. I'm conscious in my day that I haven't laughed today, and I
Mm.
and I will literally get up from my desk and go look for something to laugh
Right
at,
to laugh at. Yeah.
and I'm not right if I haven't laughed, and so I have to, and but like we make the worst patients, and so sometimes the advice that I give to people I don't always take myself, and so it's good. I'm glad you're asking me this because it reminds me of what I need to do too.
That's right. Well, uh, that's a very positive way for me to ask the next question. And I know we're
Hmm.
about to wrap up, but I know that we inspire each other. And I remember when my oldest son, decided he wanted to do his Ritmus Negros. I mention this podcast every chance I get. So it's
Okay,
Ritmus Negros podcast. He was a
I'm
previous
gonna write
guest,
it
and we
down.
talked about, yeah, and I think it's Ritmous and Negros, Megros, and it's Black Rhythms, and in English and Spanish. So you got 5 daughters, I got 2 boys, and so proud that he does it in 2 languages. They're both doing great. He'll be graduating, getting his master's, so I'm very proud of him. And
Nice.
but I'm gonna tell you, podcast, right? So as we listen to you share your message today. It's clear that you have a lot to talk about, and it's nice to know that maybe just maybe you may be starting your podcast in the near future. So I want you to talk a little bit about if you have a podcast in the very very near future. What types of things would you like to share during your podcast?
Yeah, so I'm glad you asked me this, Dr. Hampton. I'm a big fan of yours, always have been, and I don't care if people think I'm a copycat. I don't care. I come, you my brother, so hey,
That's right.
Dr. Hampton can do it, I can do it too. Um, so I mean, similar. I'm really passionate about the community, and I want the
Hmm.
community to be empowered. And so I definitely want to share empowerment to the patients, empowerment to the community, so that we can advocate for better health conditions. And there's nothing like I think what's my brother's name, and um, Fred Hampton, said the
Hmm.
power is with the people,
Hmm.
and I just feel like that, that healthcare is particularly in the U.S. have been hijacked by big business, and
Hmm.
big business can tell a patient who money is coming out of their check to pay for insurance, to pay for care, but yet big business can determine that here's how the care is going to be given to you. Well, what
Right.
amount of money did you put in to
I
tell
know.
me how my care should be
I know.
given? And even what amount of, you control how much the doctors make. And that's crazy to me. These
I
guys been
know.
in school their whole life. They dedicated their whole life. Dr. Hampton, I remember being 1 o'clock in the morning and we're leaving someplace, coming from studying. I
Oh
mean,
man.
that was 10 years of our life.
Yeah. It was a
I mean,
it's a
it
huge
was
sacrifice.
it's unbelievable that people don't
Yeah.
realize how much sacrifice it takes. And then you got somebody that got an MBA someplace and they deciding how much money you make or
Right.
what your
Yeah.
hours are going to be, and it's
And
crazy
you gotta
because
see
our
4
patients,
patients in the hour, et cetera, et
yeah,
cetera.
like it's all of that, and
Yeah.
you don't know what it takes to see and you don't have to sit in front of this person and tell them that they have cancer or tell them that they're HIV positive, and then say, "Oh, but your time is up." Like
Right.
that's
I know.
I mean,
It's
come on, come on.
it'll
So
make you
I
sick.
want to talk about those things, empower the patients, empower the community, and then hopefully, I mean, I can be as successful as you are.
Well, I think you will for sure. And I can, if you, let me say this, I promise you, I will make sure people know about your podcast when
I
you put it
appreciate
out
that.
there. All I ask is that you make me one of your, guests at some point. Don't wait to episode 56 like I did. So
It's all
that's all
good.
I ask. You get me in a
Hey, you
little
know what?
earlier.
You know I'm you know I'm your brother, so it didn't matter to me. No matter what, I'm always
Oh,
support you.
absolutely.
That's so that don't mean nothing. But what matters to me is you and make sure you good. And so yeah, absolutely.
Yeah.
You got top slot.
Hey, that's it, man. So let's make sure we wrap up with the most important question, which is, protecting your nest. And, everybody knows that's about nutrition, exercise, less stress, more sleep, how we think, recovering from trauma. We've touched on most of those, making sure our relationships are serving us, avoiding organisms and pollutants, and obviously protecting our emotions and our life experiences. So when you think about that nest and rope acronym, where is Dr. Pete going to, put your focus over the next year?
Yeah, I think, man, you want me to choose, my brother? I mean, like, that's like, I want them all. But let me just say, for me, the particular challenge, because I had just being completely transparent in front of your audience, I picked up a lot of weight
Yeah,
during the pandemic. So for me, I really want to double down on the nutrition aspect. I really want to
yeah, yeah.
double down on that
Okay.
and just really focused on it. I thank God just recently I lost 15 pounds and I'm going to continue with that. But that has been 99% done with my nutrition. It's been because I've always been in the gym, Doc. You know that. Ask anybody where I am at 5:45 in the morning. They can tell you if somebody wanted to be a sniper on me, I'm dead because they know where I go at 5 a.m. every morning, but it's
Mm,
nutrition. And for me, I'm going to double down on that and just be conscious of what food I put in my body and be more intentional that every food will do one thing for me, reduce inflammation. And so rather, I just want to reduce inflammation, reduce sugar. I think sugar is a major contributor to
mhm,
disease and death in our community. I want to reduce that. And that thing tastes good. It's powerful, my brother.
mhm.
It is
It is.
powerful. I'm not even a big sweet eater, but that thing hits my lips, and it's like
Mhm.
another whole thing takes over. So I relate it to like heroin and things like that. Anytime I think that I can't relate to my patients, I say, well, wait a minute, what's your heroin? What's that thing that calls you at night? So I don't judge, but yeah, doc nutrition is gonna be my thing. I'm a really double down on.
I love it. And the irony of sugar, a lot of people think about, and when you think about communities of color and you think about the slave trade and industry and all the things that happen, people think about cotton, but sugar was probably one of the worst things that ever existed, not just in terms of what we consume, but the impact it had on African Americans back in the day. So it was, I mean, it was a ridiculous impact that was negative. So there's many reasons to not like sugar, and that's just, those are just two. So brother man, people may have heard your voice today, and they want to know, is there a place they can find you? On social media or wherever? What would you like to share?
Yeah, so I'm also a partner in a group called Prima Health Solutions. So my website will be going up very soon. It's www.primahealthsolutionsllc.com. I'm also on social media as uh, Pete Thomas on Instagram, and I'm on TikTok, Snapchat. I'm on all those things. There's Doctor Pete BT PT BT 06 is the year of our fraternity. So normally anything I have, I'm gonna put 06 behind it. And so yeah, that's a good way to find me. So most people hear me on TikTok. I do a lot of health short little videos on TikTok, and some of the stuff I talked about today would be on TikTok also. So yep, that's it, Doc.
All right, man. This was beautiful, and I love you and I appreciate you. I'm just so happy we finally had our
Yeah.
moment, I'll throw up a little Black Panther on you real quick, and all of that. That's right. You better let them know it. So I appreciate you, man, and looking forward to the work you'll be doing in the future. So thank you so much. Okay.
Appreciate you, bro.
All right. So today's episode, guys, was very refreshing for me, and I hope for you, because I spent some time with an old friend and a new friend for you. And, to be completely honest, if it wasn't for us sharing that platform that I was invited to, Couch Conversations with the Doctor with Danny Davis on Facebook, we do that on Monday at 7 p.m. Central. So you can look for that. But if it wasn't for that, I'm not sure these two busy docs would have had time for each other. So I'm just thankful for that platform. I'm thankful for Dr. Peter and Nikki Harvey for inviting me to participate. And today we had a chance to hear some new insights about the world of HIV, social determinants of health, opioid addiction, and I'm just hoping that the words that were spoken today help to inspire you, especially this idea of going to the clinic and having a barber cut your hair while you're talking to the doctor. I really love that. So as we conclude today's episode, I hope, Dr. Pete's been able to inspire you so that you can, kind of look around and reconsider and say, well, what impact can I have on the world? This world that I live in, what will my legacy be? And there's so many ways to do that. So just do your small part, so that when you look back on your life, you'll be able to say, I did what I came here to do. Let's leave this world a little healthier, maybe a little bit more tolerant, and most importantly, better than how we found it. So I thank you again for being with me today. And until we meet again, be safe, be well, and continue to protect your nest.